All right, Dr. K, thank you. Well, researchers at the Regenstrief Institute in Indianapolis are taking the lead on numerous important healthcare issues, from collecting and analyzing data on opioids to the study of how certain drugs could possibly cause Alzheimer's and dementia, to conducting trials on ways to eliminate back pain. And that's not all, really just the beginning. And I'm pleased to be joined by Regenstrief President and CEO Peter Embi to learn more. And Peter, welcome to the program.
Thank you, Gary. Great to be here.
You know, I think a lot of people, maybe they've heard the Regenstrief name, many have not, and have no idea of the world-class institution that this is right here in Indianapolis and celebrating 50 years.
Yeah, it's really a well-kept secret, and so we're very excited to be here to talk more about the Regenstrief Institute. As you say, 50 years. So if I could just say a little bit, in 1969 is when we were started and launched by Sam Regenstrief, who was a regional entrepreneur and really saw the vision for how to improve efficiency and effectiveness of healthcare. And since then, over the last 50 years, the Regenstrief Institute has done some of the most pioneering work in the field of health and healthcare to bring information, technology, data, and care models to improve practice. And that's really what we continue to do today.
We talk about data and analytics in healthcare, and really, again, to kind of underscore what you're saying, much of it, you know, happening here at the Regenstrief Institute, and really you can trace back to work here in Indy.
Yeah, absolutely. In fact, across the world, the Regenstrief Institute is recognized as the pioneer in that regard. Many people don't know the earliest electronic health records, health information technology solutions, a lot of the standards that underlie the current environment were really invented right here in Indianapolis at the Regenstrief Institute, and then led to the development of a lot of what we think of as modern day health IT.
Yeah, there's also, I remember we've reported on it in the past, the Indiana Health Information Exchange, which is another unique aspect as well.
That's right. In fact, the Indiana Health Information Exchange is still considered the largest and most robust health information exchange in the country. Wow. And it emerged from work that actually happened at the Regenstrief Institute. And now our close partners who run the Indiana Health Information Exchange are an independent nonprofit, but it really came out of work that started at Regenstrief.
And you talk about some of the specific work. I mentioned the opioid crisis and IU's grand challenges. I know the Regenstrief Institute very much involved in that as well.
Absolutely. As a support organization to the university and the School of Medicine, we work closely with our collaborators to address that. So taking the data that we have available and then working with our data partners across the state, whether it's state agencies or other institutes and the like, to pull data together in order to be able to better characterize and understand the crisis and be able to address it. Obviously, a terrible crisis for our state and one that we need to address. So we've stepped up to create what we call the Indiana Addictions Data Commons to be able to have a data resource that then many can leverage for that.
Collaborations and partnerships are very important with universities, but also private sector companies, and talk about those, the importance and some of the variety of those partnerships.
Yeah, really critical, and as you say, quite varied. So, for instance, another grand challenge we're very much involved in with the Indiana CTSI and the IU School of Medicine is the Precision Health Grand Challenge that spans IU, and in that case we partner very closely, for instance, with Lifomic, one of our leading companies here in Indianapolis. We also have collaborations, longstanding collaborations for several years now with a lot of our colleagues in industry and pharmaceutical companies, be they outside the state like Merck and Pfizer, or internally with our colleagues across the state with Eli Lilly, of course, right here, and Roche. We work closely with the Indiana Biosciences Research Institute and others on issues of diabetes and tobacco cessation, as well as the opioid crisis.
Yeah, and you also, I know, have an interest in connecting with entrepreneurs and innovators, and really trying to get some of these great ideas and things out to the market, right?
Yeah, it's really critical to our mission. You know, we recognize that doing good research is very important, and being able to get the knowledge out there is important. But at the end of the day, if it doesn't have an impact on people and it doesn't actually make its way to help people's lives, then it's not sufficient. Our mission is to change people's health for the better. And so a lot of that does, in fact, require commercialization. So whether it's our internal innovations, some of which we launch as startups or we might license or what have you, or whether it's partnering with external companies, we do a lot of that, and increasingly we're doing more because it really is about getting our discoveries out into practice and making sure people benefit from them.
Amazing work being done at the Regenstrief Institute here in Indianapolis, now 50 years old, which is quite a milestone. Peter Embi, thanks for joining us. We'll talk to you soon.
Thank you, Gary.
All right.